Hi everyone, my name is Haley Aho, and today I'm going to be telling you about the rise in anxiety in teenagers we have seen lately. As a teenager, feeling nervous or stressed may seem like a normal thing, but is there a way to control the amount of anxiety in teenagers who have a hard time dealing with this? Doctors and specialists are starting to see a rise in teen anxiety, which is a nervous disorder that causes great unease. Being a teenager myself, I have dealt with a great amount of anxiety and stress on a daily basis. I think that everyone should be aware of the amount of anxiety average teens have, and there should be something done about this. Let's start with what anxiety actually is, and the symptoms that are associated with it. Anxiety is a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. There are so many different symptoms of anxiety. Some of these anxious symptoms include uneasiness, panic, fear, sleep problems, inability to stay calm, dry mouth, nausea, dizziness, and many more. Everyone experiences different symptoms of anxiety, but they are all very hard to cope with. Anxiety doesn't have an exact cause. It can be caused by many different things, and it can be different for every person. Some of the more common triggers can be caused by changes in your brain, environmental stress, and even your genes. Now that we have discussed what anxiety exactly is, let's now discuss the rise in anxiety in teens that has been seen. There has been a noticeable rise in anxiety amongst teenagers in recent years. Doctors have done many studies, and these show the increase in anxiety and depression. Some assessments reveal a startling 5 to 8 times as many high school and college students who meet the criteria for major depression and/or an anxiety disorder diagnosis, as was met half a century ago. 85% of college students today fall above the mental illness score of students in the 1930s and 1940s. We've discussed the rise in teen anxiety. Now let's discuss what can be done to actually treat the anxiety. Anxiety disorders and depression are treatable. Treatment includes counseling or medication. Types of treatment include self-care, therapies, medications, or specialists. Some ways to help anxiety by self-care are avoiding alcohol, reducing your caffeine intake, physical exercise, stress management, quitting smoking, relaxation techniques, or even going on a diet. Types of therapies are cognitive, behavioral therapy, meditation, or even psychotherapy. Types of medications to take for anxiety would be antidepressants, sedatives, or nerve pain medications. Types of specialists to see would be clinical psychologists, psychiatrists, or primary care providers. Certain treatments work better for some people than other people that suffer from anxiety. Trying different treatments will allow for you to find a way to help your anxiety in the most effective way. In conclusion, there are ways to stop this rise in anxiety and depression. Teen anxiety and depression has risen, and this is proven by studies and specialists. There's so many different treatments that can help these teenagers cope with their anxiety every day. I feel that if we worked harder to promote these treatments and made sure teenagers didn't feel like they were the only ones suffering, this rise in anxiety would stop and maybe even get better. Something should be done about this rise in anxiety. This is a hard disorder to deal with, especially at such a hard stage in your life, teenage years. Thank you.